afternoon, all. My name is Andrew Whalen, and I'd like to welcome you to the quarterly DD Community Forum. This forum will be informative, and it will also give you a chance to let your voice be heard and ask any questions you have. There will be a question and answer time later on when you can type your questions into the chat box. Every effort will be made to answer as many questions as time allows. And now, without anything further, I will turn things over to the Director of DD Services at BHDDH, Mr. Kevin Savage.
Thank you, Andrew. I appreciate that. Welcome, everybody. We're very happy to be here meeting members of the community, family members, providers, advocates, and other stakeholders. There's a lot to catch up on, but our main purpose today is to hear from you. So my team will give a quick update of where we are, and then we'll open up the floor to your questions. And I wanted to just very briefly talk about a few goals that we've set for the coming year. We obviously are working with the various stakeholders and providers in the Department of Justice to continue to work toward meeting the goals of the consent decree to make sure that we're going to put ourselves in a position to be able to complete it by 2024, which was the target year for meeting substantial compliance with the requirements of the consent decree. So we're going to be working and continuing to work on that in this coming year. We'll also be working largely through our continuing budget conversations with providers to work on post-pandemic preparations for how we're going to reopen, what that's going to look like. There are a lot of questions to be answered, probably more questions than answers still, but now that we've gotten through the vaccination phase with the DD community and many of the staff, we can move that conversation forward a little bit more. We're also going to work on continuing the conversation on what person-centeredness means so that we can make sure that when we use those terms, we're all referring to the same thing, and that we're increasing and improving person-centered choices and person-centered decision-making in the coming year so that we're continuing to improve upon a community-based and person-centered system moving forward. To that end, Brenda will later in the forum talk about, give an update on where we are in conflict-free case management. So those are kind of a few of the things that we're working on in terms of a little bit of a report out and what our vision is moving forward. So we can certainly that as questions come up later in the program. This is DD Awareness Month, and so Ken's going to give a little bit of a discussion on Circle of Connections, which was featured in a couple of articles, one by BHDDH and another by Gina Macris in her article. But I think that's been one of the exciting sort of homegrown innovations that I really hope to spend a little bit of time discussing, which I think is one of the more exciting and person-centered things that has been developed as a response to COVID, but something that I think will be sticking with us beyond the pandemic. So Ken?
Thanks, Kevin. So welcome everybody. It's great to see all the panelist faces, and I look forward to seeing who's on the call later on when we have questions. So I'm going to talk about circles of connections. And while I do that, what I would love everybody to do is find your chat box. And in your chat box, just write down in a few words, what do you like to do in your free time? So things that you like to do in your free time, it could be a hobby, activities, anything that you like to do in your free time. So if people could just type that in now, that'd be great while I'm talking. So circles of connections, back over a year ago now, when the pandemic first started, there were a few of us that got together and said, you know what? We're really concerned with the pandemic about isolation of people with disabilities and their family members. And what can we do about that? So we thought, well, why don't we just start doing some online conversations with people, get them together around a shared interest or something they just like to do. So some of us typically do, we reach out to some of our closest colleagues and say, hey, what do you think about this idea? So we called Kevin Nerney at the DD Council, said we wanted to start this virtual online community to connect people during COVID so that maybe the isolation eases up for them a little bit for an amount of time. So he thought it was a great idea, and we started calling people and getting group leaders gathered together that we could train to lead these circles. One of the first people that I called was Deanne Gagney because of her skills and her wonderful personality to be a group leader. And we talked about starting our very first circle called Chat Saturdays. So just a social circle that people could jump into and talk about things that matter to them. So that was our very first circle. And through up until January this year, we did what we call a soft launch. So trying it on. We now have 10 group leaders that have been training with me weekly on trauma-informed approaches. So they know how to host conversations and really listen to people and what their needs are. And we have 9 circles up and going with probably 3 or 4 more coming out this week. So the circles that we have are Chat Saturdays. We also have a family group. We have a special education advocacy group. We have a rainbow group for folks in the LGBTQ plus. I always screw up those initials in my head. And we also have a building healthy relationships group. We'll be starting a financial literacy group soon. So one of the goals is that we listen to people with disabilities and we listen to family members about what do they want for a circle or what might be an interesting topic to start a circle about. So some of the new ones we will be adding are financial literacy and a book club for kids. So it's very grassroots, like Kevin said. It's just a bunch of us trying to make the best of how we can keep relationships going during this time of the pandemic. And what will happen after the pandemic is circles of connections will continue, and then we're just going to move it into real life. And people will be gathering and getting together and having some fun, sharing some laughs. And I see that there's 30 people in the chat box that have commented about different things. Deb or Michelle, is it possible for you to save the chat box for me so that I can take a look at it after?
Yes, absolutely.
Yes.
Thank you, Michelle. So that would possibly give us some really cool ideas for some new circles that we could generate and put out there to people.
Ken,
Very-
before you go, Keith is watching this on Facebook too. So if people wanted to type it there, Keith, you could say, we could get that to you too. So we want to just say it one more time for people on Facebook. You want them to say things they like to do, hobbies?
Yeah, absolutely. Yeah, if
All right.
people could just let us know what they like to do
Okay.
for hobbies or what they do in their free time. Some of the great examples we have are painting, cooking. We do live in Rhode Island. Lots of people like to go to the beach or walk on the beach, watch documentaries, a lot of cooking, which is cool, and bowling stuff, bike rides, Legos, listen to music. And I don't know if I mentioned this, Special Olympics came up a couple of times. So some really cool things. So that's kind of like a little snapshot of circles of connections if you're interested in circles of connections. I'll get Michelle and Deb our circles flyer We can send it out that way. Also, if you go to the ARC Rhode Island website and click on Circles of Connections, there's an application form that you can fill out. It's very simple. You just put your name in there. If you don't want to fill it out, you don't have access to the internet, you could call. I'll put my number in the chat box. You can call me directly and I'll walk through an application with you. And you just let us know what you're interested in for a circle. And when we have a few people that are interested in that particular circle, we get it up and running. And you'll be making some new connections, some new relationships, and have some great fun.
Thanks, Ken. It was a great update. And I think just a really exciting thing for people to be involved in getting to know each other better and getting to know people outside of their living group, which I think is really exciting.
Can I ask one question, Ken? It's not just a
Sure.
disability thing, right? It's just people who have an
Oh,
interest in
absolutely
something.
not. Yeah,
Anybody.
Yeah, lots of our groups are, there's for anybody really. So some of our group leaders are folks with disabilities, some of our family members, some are siblings. So we have all sorts of people leading the groups and a part of every single group. So they're open to anyone. And I'm just going to type my phone number if you want assistance or you have any questions about circles.
And just so people know, we're recording this and we'll put this on our website and there'll be a link. I mean, it'll be on the Buddha site. So Ken's, and Ken, you could also find his phone number on billboards across Rhode Island if you just drive by the highway. So either way, you'll be able to get him.
Thank you, everybody. Do we have any questions about circles?
Ken, someone did ask in the question and answer how they would sign up, if you want to go over that again, how to sign
Sure.
up for circles.
There's a couple of different ways. The first way is you can just call my phone number and I'll help you fill out an application if you want to do it that way. The next one is that you can go to the ARC Rhode Island website, and on there, there's a Circles of Connection button. If you click that, the application will come out. I'll put my email in the chat box. You can shoot me an email. I'll send you the flyer, and there is a live link on the flyer for Circles of Connections that you click on and the application opens. You can fill it out that way. And I'll get the flyer to Michelle and Deb. So if you're connected with Michelle and Deb, they'll be able to share that with you as well. Somebody asked a question, Arida asked a question about starting a Circles of Connections for Spanish families. Absolutely, Arida, let's talk about that. That's an interest that we have. We always have in our mind started, but we really want to hear from the community, what do they want, and be able to respond to that. So I would love to do that with you. I'm going to type my email address in the chat box. So if you're
the thing with
listening,
the chat box is it keeps jumping. People are saying they can't see it. So I definitely will put it up there. We'll put it on the website. We'll put it, Dee Dee will put it up there because people can't see it as much. Maybe you want to just say it out loud, Ken, because people are saying.
yeah, sure. So my email address is Renaud at the ARC. So it's RENAUD at THEARC.org. My phone number is 401-855-3343.
All right, thank you, Ken.
Thank you.
So we wanted to talk a little bit about COVID updates. First, just our hearts go out to anyone who's lost anyone during this pandemic, or anyone who's gone through any kind of serious or extreme suffering or hospitalizations or just loneliness. This has really been, I think, a much longer haul than any of us expected as we were heading into March of last year, just when kind of the lockdown started to go into place, and we realized that our lives were going to change for some period of time. I don't think any of us anticipated last March that we would still be on some kind of restriction in a year from then. So But what I think we're looking forward to is that hopefully home stretch, and we'll be heading back into something approaching a new kind of normal. And I really want to just give a huge shout out to CPNRI and our providers and some of the folks at RICLAS who participated in manning some of the clinics. Tina Spears really took the bull by the horns and coordinated with Department of Health and DMAT to manage getting vaccines done. And that was no small undertaking. The coordination was phenomenal. Worked with a lot of people to really manage and coordinate to get anybody who wanted, anybody in the whole DD community, not just people living in residential care, but the SLA community, the SLA community, self-directing people living at home and working with agencies, basically any of the 4,000 plus adults with disabilities working in our program, staff, self-directing staff, one member of a family member living at home. The coordination was phenomenal. The work was just incredible. And they had to, because we had the vaccines where you had to go twice, everybody who went, it had to be done twice. I know that the department staff did a lot of work in terms of registering people who were self-directing, but a lot of the work was taken on to minimize the impact on adults with disabilities to have to try to navigate that themselves. And so I would just really like to thank everybody who did any of the work on this. But I went out to a couple of clinics and they were always incredibly well managed. How to help people do parking, to working inside facilities to keep the process flowing, helping people know where to go in terms of after they got their shots, where they needed to go to separate for resting, to make sure that they could be monitored in case they had a reaction, keeping people who lived in the same home in separate areas so that if anybody had exposure, they weren't passing that on within the clinics. The process was just amazing, so well run. We did it without long lines to keep everybody moving. I know if you've watched TV and saw how some clinics were running in other states, there were a lot of long lines and a lot of wait times. We didn't have that here. And I really just want to, again, thank CPNRI and our provider community and staff across the entire spectrum for coordinating efforts, talking to each other, regrouping, constant meetings to get this done. Thank Department of Health and DMAT for obviously delivering the vaccinations themselves, but it took a lot of effort and it was done just to near perfection. So thanks everybody for being involved in that. And that's going to allow what's coming next. And Leclerc revised our visitation policy so we can begin to allow a more flexible visitation. I sent it over to our medical director today so that we can get clearance to get it out so that we can start to have people see their loved ones on a more regular basis. And hopefully that will help not only with providers being able to facilitate people seeing their loved ones, particularly in congregate care, but just help with some of the mental health effects of people not being able to see the people who care most about them. So we'll be getting that out so providers can look at it to see if there's any necessary changes before we send it to the general public. We'll want you to review that first, but that's going to be coming out in the next day or two. We're going to continue working on what reopening is going to look like. One of the key issues in that, needless to say, is how are we going to staff reopening? And so we really need to work closely with our provider partners to figure that out so we can get more information to family members who are really wanting to know what the answer to this is going to be. That's going to include more budget discussions, and we'll get to the budget in a minute. and coordination with our providers who, of course, want to provide that service as quickly as possible, and ensure that when we reopen day services that aren't open yet, we're doing it in a manner that, as I stated earlier, provides the most person-centered reopening and the most community-based reopening in a manner that wasn't as available before as we hoped it would be, that we can move forward in the right way that allows the proper amount of separation and also the most important community connections that people can make going forward. So we're continuing to work on that. We'll continue to work with our providers and continue the budget discussion with them. The budget release, as you know, isn't the end of the budget discussion. It really is the beginning of this negotiation process, which ends with the final budget at the beginning of the summer. Status of parents continuing to be paid for caregiving. So we're in discussions with CMS to make sure that some of the changes that we've made with the pandemic can be allowed to stay in place on a permanent basis. CMS has extended their authorization to allow us to keep those changes in place through December. We've requested an additional 6 months. So working on getting that approved so that we have at least on the emergency plan to allow us to keep it in place till June of 2022. But our goal is to get CMS, or Center for Medicaid and Medicare Management, approval to those changes to be made permanently. So we'll keep you posted on that. But we think that the changes are good, not merely for the emergency, but that option should be in place for families permanently. So that's the recommendation that we're putting in place. We have time to continue to work on that to make sure that it's meeting all the Medicaid requirements, but we'll keep you posted on any changes with CMS regarding that going forward. But it looks like we have a
Kevin, did you say
January 2022.
it is 2022? Because I thought you said 6 months, so it's 2022, not this 20.
6 months. So we have approval through December of
All right.
this year.
Okay.
And we've requested an additional 6 months so that we can transition going forward. So that gets us to June of 2022. So no, that wasn't a misspeak. I've talked a little bit about the consent decree. I think we can field some questions on that if people have questions, but one of the things that we'll be working on with the consent decree is bringing together the administrative burdens groups to begin discussions this week, which I'll be directly leading, to talk about moving from recommendations. And we have the recommendations in place. They've been reviewed by the EOHHS department directors, and converting what we have for recommendations, get to the implementation phase of converting those recommendations into work plans. And so that will take a little bit of time, but we'll want to move from this recommendation phase into how we're going to map out work plans for each of the groups. And that will take talking to the groups and combining some of the groups so that the work plans aren't overlapping, but we're working together to really this year get an implementation plan in place and accomplished so that we're meeting all of the timelines that have been mapped out by the administrative burdens groups so that we're meeting the court order on time. And so that we'll begin that discussion this week and then get to a place where we have work plans in place. There are 4 other work groups that have been identified in the January court order regarding, and we can talk a little bit more about those in the budget, but we'll have work groups continuing to work to get those work plans kind of accomplished. And those are much more directly and more broadly related to accomplishing the completion of the consent decree by 2024. And I think I think that's really all I had to say about the consent decree for now. I'm sure there'll be other questions on that. Regarding the budget, I think what we're going to need to do on the budget is really put together, we can't wait until another quarterly meeting. I think what we need to do, our budget team got redeployed for another meeting and another presentation that conflicted with this, and I didn't want to reschedule this group since it had been on the books for so long. So we'll need to, in the next few weeks, bring this and bring the budget team in and maybe have a meeting just to discuss where we are in the budget process. But I did want to address a couple of questions, and one in particular had to do with the belief that there was a cut in the budget. And so I just followed up with our budget team on that. And the technicality on this is there actually wasn't a cut in the budget, but the budget itself is based on caseload projections to fully fund the needs of adults with disabilities. And in the process of the caseload projection, which takes into account a number of factors, the caseload projection was that the caseload number would decrease this year, which is what constituted a lower number for funding. But that actually didn't constitute a drop in the budget. It constituted a projection in caseloads going down. So that's what accounted for a lower number for the caseload projection. So I just wanted to clarify that. What did get added to the budget, however, separate and apart from the normal budget amount, was $27.1 million to assist providers that was designated or proposed by the executive branch to assist in structural improvements for the fiscal sustainability in the system. And that included $7 million for Transformation and Transition Fund. I'm sorry, my phone keeps ringing. I don't want to hang up on them, so if you could ignore that, would be great. And that would provide fiscal financial incentives to promote organizational change and capacity to improve quality or increase consumer access to support programs, or through self-direction or provider agency models. And we're really working with providers on what the specifics are and how the funding could be used to assist them in programmatic and structural changes within their organizations. A second area of $4 million is an opportunity for providers to participate in an outcome-based payment methodology that would, and I know this is technical, but it would allow a value-based payment program to begin transitioning provider systems to value-based payments that would be linked to quality benchmarks and performance-based standards. A third area in the package is a $6.7 million investment for ongoing implementation and administrative relief efforts that would basically cover the cost. If you'll remember that we changed at the request of many stakeholders, providers and advocates to move from quarterly to annual authorizations, and there is an investment that's required to make that happen. It could be used in other areas as well, but that was a primary area that required investment. And then there's $4 million for state infrastructure support and investment in order to accomplish the other three areas of investment. And we would bring in a group to assist us in creating the technical assistance and implementation needed to bring those areas forward. So I just wanted to update you on that. Tracy is going to give an update on where we are with employment and some of the plans there. So I'll turn it over to Tracy Cunningham.
Hi, everybody. I think that there was a question posed that was just asking about whereabouts the department stands with employment. As always, we continue to emphasize that if individuals are interested in employment support for Jay McKay and their social worker, programs are doing something a little bit different. So everybody's in a different place in space. Some providers are continuing to do employment supports throughout the entirety of COVID. Some have taken a small pause. So I think it's really an individualized question, and certainly we can put our emails in here so that you can reach out to us and or your social workers with specific questions. But if anyone is interested in getting ready to think about getting back to work or looking for work, now that we have the vaccinations and things seem to be opening up a little bit, we encourage you to look for some of that support with your providers. I know that at the end of this, we're taking questions, so feel free to pop something in the Q&A or hold your question to the end and we can answer it more specific.
Thanks, Tracy. Brenda Duhamel is going to give us an update on the status of the conflict-free case management discussions.
So the Quality Advisory Committee has been working on conflict-free case management. We have a small subgroup who was charged with putting pen to paper to begin a model. We've really been as this large stakeholder group, a group that is very focused on flexibility and individuality, while another group is sort of focused on high quality and accountability. So really our goal is to do all four of those things actually. And so we believe that the model that we're beginning to create is a very flexible system that is not at all a one size fits all approach. It really allows for people to choose the way in which they use case management services through self-direction, if they know individuals, or will have the ability to hire people if they don't know folks. So it's really meant to be a flexible approach that people can tailor to what they need and want, yet still be high quality and accountable. So that's what we're putting together. Our next step is to bring this to Medicaid, to a long-term service and supports group who's looking at case management, because case management is a needed process for everyone who is in long-term services and supports. So our small work group, just so that you are aware, has been myself and Heather Mincy, Mary Beth Canoyer, who's done a ton of work in helping us pull this together. Kevin Nerney, Lisa Rafferty, and Deanne Gagney and Amy Groton have also been on that group. So many thanks to the group who's been working on this. And we will continue to update folks as we keep moving.
Sue is going to give us an update on adult services. Sue Hayward.
Hi, everyone. It sure has been a challenging year for students and families this year, with transition services shifting to distance or hybrid learning, and employment opportunities and community exploration largely being done virtually. So we have worked very closely with the Department of Education, Office of Rehabilitative Services, Rhode Island Parent Information Network, educators and adult service providers to remain aware of the challenges and the successes that we're all experiencing, and to partner regarding how to provide transition services during a pandemic. So every year, DDD, Rhode, Department of Education, RS, Office of Rehabilitative Services, and RIPEN, we work together on a collaborative state plan, which guides our collective work throughout the year. So there's been several cooperative projects underway. One is that we have a transition work group that's been developed. It's a collaboration with RIDE, RS, DDD, and representatives from school districts and also adult provider agencies. And we're focusing very specifically in that work group on the last 2 years before school exit, working on improving communication and understanding about transition services provided through school-funded supports, adult providers, and also local community resources. So the focus is very much on whole life planning and person-centered supports. And we're having some very meaningful conversations about what is working, where challenges exist, and also sharing creative models of transition support within our own communities. We've also developed a transition community of practice that was begun last October with representatives from adult provider agencies, meeting quarterly with myself, the DDD transition administrator. And the goal of that, the formation of that group, is really to ensure consistent and timely communication, discuss challenges that exist and that arise within transition services, also share resources. So as I said, we meet quarterly. Our third meeting is coming up in April. One of the initial steps in that group has been to collaborate with the Department of Education and the Transition Advisory Council coordinators to hold what we're calling provider chats, which are opportunities for adult service agencies to communicate directly with educators through facilitated conversations. So we can understand from each other's perspective how transition is approached, how communication can best take place when working with a student. 6 of those provider chats have taken place. There's 6 more scheduled within the next few weeks. And these conversations have turned out to be great. They've led to very open and meaningful dialogue. And we are working to expand these chats to students and families this coming year. Department of Education has also been very generous with their resources with this group, and they have opened up many of their trainings to adult provider agency staff. So for example, recently, there has been an opportunity to participate in community mapping training, virtual job shadowing, post-secondary education options. It's been a really great and very appreciated resource that Rhode has shared with us. With RIPEN, we have developed some peer-to-peer webinars. 2 have taken place in late fall, one for young adults having real conversations about employment, and another peer-to-peer webinar for parents also discussing employment. We're working on a 3rd webinar, which will focus on customized employment. We're working on this in collaboration with Tracy Cunningham. And a 4th webinar is also being planned. It's still under consideration, but it will take place before the end of the academic year. This year, I did also some outreach to the homeschool network to and make sure also that we're being responsive to the transition needs of youth who have been homeschooled. Outreach is an ongoing activity within transition, and we do that for our resource development, for social service, especially to share with families and other professionals with whom we're all working, but also to make sure that we're keeping in touch with community entities in regard to the needs of transitioning youth. So most recently, aside from the homeschool network, there's been communication with the Autism Project of Rhode Island, the Educational Advocates Office with the Sherlock Center, and various community resource organizations in regard to continuing education, opportunities for community connections, virtual therapeutic exercise classes, and of course, also other classes and resources that are available through Rhode, Sherlock Center, RIPEN, Department of Labor and Training. This week, I'm participating in the FEAT training that's being held by the Sherlock Center, which is a wonderful opportunity for families to think very expansively about employment with other parents and professionals in the field. So that's a wonderful opportunity for us to hear from parents how they're thinking about employment, and also to share information and improve our transition services as well through those good conversations that happen. We're also continuing social caseworker assignment to an eligible youth by the age of 20 or 1 year prior to school exit, because that gives a good solid year or 2 for social caseworkers to support students and their families and work with the IEP team as the student is preparing to exit school-funded services and move into the adult world. So social workers are provided ongoing information and resources for that work. Perhaps Kevin is going to mention this, but I'll mention it here, and that is that our webpage has changed. And so the transition services link on our website is in a different place. So you would still go to find it, you'd still go to bhdddh.ri.gov. However, you hover over the Developmental Disabilities Services part of the website, and the transition services page should pop up. So happy to hear any suggestions, or please put them in the chat if you have a question or a suggestion. Thank you.
Thank you, Sue. Sue, I called Sue this morning to remind her about the presentation on transitions, and she had gotten it on the agenda, but I hadn't talked to her personally. But she gave me words to live by this morning. She said, "That's okay. I'm preparing my presentation and I'm always prepared for surprises. And I thought that was a great quote. So as we've gone through this year of surprises, I think being prepared for surprises is probably a good thing to live by. So anyway, thank you, Sue, for your professionalism and the great work you do every day. Appreciate it. Okay, Anne Leclerc is going to give a brief update on housing, and then we're going to move into questions and answers. So Anne?
Thank you. I don't know if everyone's aware that Plan Rhode Island has been hosting monthly Zoom webinars for this year. We'll continue through this year with guests from around the United States and Canada discussing best practices in community-based housing and innovative models. So it's very interesting. If people haven't done it, you can still register for it. They've also been having conversations those are on the 4th Wednesday of the month. They've also been having conversations on the 1st Wednesday. And we've added what we're calling kind of office hours with BHDDH, partnering with Plan Rhode Island, to hear from individuals and families about your ideas for housing, for community-based options, preferences you have, questions you have, any of your housing dreams. We want to hear about all of it as we try to determine what to do going forward. Michelle Brophy is co-leading that with Betty Murray from Plan Rhode Island. All of the meetings start at 6 o'clock, and registering for either the office hours or the overall series, there's one registration. So I can put the link in the chat for anyone who hasn't registered and would like to. And if anyone has questions, please let us know.
Thank you, Anne. There's a question in the chat box. There was a item on the agenda about self-directed supports changes. So if I wasn't clear, we made some changes during the pandemic to allow parents and family members who had previously not been eligible to be funded for providing supports. And that's really what I was talking about. We're working with Medicaid, which will eventually work with CMS to make those changes permanent. They are currently permanent through June of 2022, currently approved through June of 2022, but we are working with Medicaid now and will work with CMS to make them permanent. So I was referring to the changes for the self-directing population, if that wasn't clear. So I hope that answers the question for the person who added that to the chat box. Okay, so let's open it up. And I or whoever is on the panel will be happy to answer any questions that we're able to answer for the remainder of the time. And I didn't realize it would go this long. I was hoping to have more time for questions.
We have questions that people, you hit on some of the ones that people send in ahead of time, but just in case, I'll make sure that we had those.
Okay.
But the ones that are in the chat box so far, you hit on some of those also, but just to make sure, may I ask for any S109 updates? Is there any chance of extending for another few months?
Is that referring to the S109s for SLAs?
It just says S109. It doesn't
Yeah,
say.
it's not clear what they're asking. If they're asking regarding S1 SLAs, the answer to that is yes.
Okay. And then I'm not sure if you answered this. What's bringing up the decrease in caseloads, and maybe just how do they estimate the caseloads?
This isn't the case estimating conference. It's done every year. I will be honest, it's too new to me to be able to effectively answer that for people. So I'm going to not attempt it. I know that the model that OMB uses has been in use, and it's how the budget gets established every year. But I had talked earlier about we'll need to bring on our fiscal team who wasn't available to come today going forward, and they'll have to help us with that. And I'll try to get a meeting. I will get a meeting scheduled in the next few weeks so that we're not putting this out too long. Budget process through the spring. Yeah, I wish I could be an expert on that, but I'm just not.
Okay. Somebody else wanted to know, so this is a bigger question. I am a parent and I just don't know all the resources out there or what my daughter is entitled to. Transportation is a very big issue, door-to-door transportation. I have heard about self-directed, but it is very hard to find someone in our area. Ride and Uber don't even come out to Little Compton with all of the organizations. Is there not one solely for rides like the Ride program?
Dan, can you help with that?
I can try to, but unfortunately, the rural areas of the state really don't have many options.
This is Marlena, if it's okay, maybe
Yeah.
we could take that question back and talk to that individual separately to see if we can try to figure out a solution for them.
Yeah.
Transportation is quite a complicated benefit and it
Yeah.
ranges from, a Medicaid standpoint to an IDD standpoint.
Mhm.
But if we could get that contact information, maybe we could outreach and then get back to the group on some broader
Yep.
piece of information.
I think the other thing that people, when we talk to people about Ride, the thing that gets like a little bit lost there is Ride is just like an equality thing. So if there's not a bus there, if there's not public transportation there that anybody can take, that within, I think it's the 2 mile, then nobody can do it. And so part of it's just needing more public transportation overall, because it's not supposed to make it that's if you have a disability, you have special access to this transportation. It's that you should have access to transportation. And if nobody in that area has it, then you're not going to get it. So it doesn't make that any better saying that, but that's one thing that we always, when we talk to people and try to explain, it's a bigger piece than just a disability issue. It's a lack of public transportation overall. But there's a lot of other questions built in there, because this person said that they just don't know all the resources that are possible. And that ties in with another question from Keith. Can you tell everyone where people can find their caseworkers? Because some people still don't know who their caseworkers are. Because you could talk to your caseworker. That would be one of the things, like Marlena said, that could follow up with some more individual help. And so if you do your caseworkers, you could ask some of those questions. Katie Sacco just said that if people don't know their social worker, they can just call the main DD number, and that's a place to start. Then another question from Irada Williams. Am I pronouncing it right, Irada? I hope. Yes. All right. It said many great things are going on for families who have access to computers and Wi-Fi. What efforts are being made for families who don't have access?
Actually, as part of, and I saw that Claire Rosenbaum is on the call today. So as part of what we're talking about through all of our groups, particularly in the administrative relief groups, is ensuring, and Claire is very, very faithful in making sure that this comes up, communication to people who don't have access to technology, so that when we do our work plans for the administrative burdens group, one of the things that will come out of that is to make sure that we're addressing all kinds of communication going forward in the department. But we don't want people falling through the cracks merely because technological communication isn't something they're able to access. And the court monitor as well has made sure that this point comes forward in discussions with him, the requirements on the consent decree. So thank you for bringing that up. I think it's a good point to consistently bring forward. We do talk a lot about improving technology because it does help a percentage of people, but it's not the only answer.
That my primary concern is the effect of budgetary changes and the move to privatize the group home system.
That's related to RICLAS. So I'll just tell you historically. So when RICLAS was created, it was not created to be permanent. And so it's been around for, it was created after Ladd School was closed. But it was always intended to be a temporary solution. And we know in government, often temporary solutions become less temporary than they're intended to be, but it was never the intention to keep RICLAS open forever. It's decreased in size considerably. I know Erin is on the phone, on the call, and she may be able to tell you what the numbers have decreased from from its peak until where we are now. But we are moving forward as part of the budget to move people toward existing providers. Now, whether, so we have, this is the beginning of this new discussion. I know it's been discussed in the past on this, on how we're going to get from where we are now to being able to support providers, to be able to take on the right class participants we have now, and how that would be funded. So we're in the very early stages of this. It's an ambitious goal, but that certainly is part of where we are. But I do, for the person who asked that, I just want to remind people and remind that person who's very concerned that right class was always intended to be a temporary solution. So it's really not new.
Does anybody that didn't have a question yet, ask one yet, that they want to type it in, can type it in into the question box? I don't know. I didn't see if any were in the chat box, but Michelle was looking there. So does Michelle, if you have any there, Michelle? Then there are some questions that were that people put ahead of time when they registered.
I looked at the questions before
Yeah.
we went on, so I tried to incorporate as much as I could into what we presented today.
There seems to be a question in the chat box that is different people have asked a few times about, can people receive remote supports past the state of emergency?
Heather, can you help on this? Is that the same dates as the SLA question? I mean, as the self-directing answer?
Well, that's what I was just going to say. I don't really, if someone could clarify, because yes, so if people are, if they're asking in regards to self-directed services, then yes, because that's not just Rhode Island state of emergency. That was extended through the public health emergency, which the federal government determines what that date is. But I'm not sure if that's exactly what people are asking.
I think what they're asking is if you're getting telehealth or any kind of remote services that have been approved, is that continuing to be approved through Medicaid?
Yes, that would be, because that would be part of the public health emergency. And yes, that was what Medicaid requested. Continue past our well, let me say, it may continue past our state of emergency because we don't have an official end date. I think it keeps getting extended. So it could keep getting extended throughout the national public health emergency.
Okay. Does that
So
help?
I know I'm being clear as mud when I say that.
Somebody said, thank you, Heather. Yep.
Okay.
The question was for all individuals. Some of the questions, it's going to be hard to answer because it's different for each person. So if the answer is, if you don't hear the answer, then definitely call you guys, right? I mean, if it's a specific answer, you could get more of a individualized response if people had more information that you might not be able to put in this public forum. Another question was, Linda Armstrong said, was the closure of right class system not worked into decrease in the governor's budget?
Say that again.
It says, was the closure of right class system not worked into the decrease into the governor's budget? Did they think about right class in the budget? Is that reflected in that?
Right class is reflected in the budget.
Can family caregivers get paid if they are not using self-directed supports?
They're not using self-directed supports. No, I don't know how they would.
No, that wasn't. So it is for individuals. For parents to be paid as caregivers, they would have to go through a self-directed program.
What are the 4 new work groups?
So I can't remember. Actually, I didn't write those down. There's a fiscal work group. There's a transition fund work group. There's a work group identifying other funding streams, and there's one other one, and I don't remember what that one is.
Caseload.
The caseload estimating work group. I thought that was fiscal, but
That's, okay, so that is fiscal, yeah, there's the strategic, like the visionary, the transition, the fiscal work
Oh,
group.
yeah, the programmatic work group.
Yeah.
Anyway, we'll clarify that and get that information out for people.
Okay.
To make sure that everybody knows what it is.
Did I just hear you say parents as caregivers can get compensation? I was never notified of this. My disabled daughter lives at home with myself and my husband.
What that person should do is she should call me directly. And my number is 462-0581, and we'll figure that out.
In 2016, there was an effort to shift shared living. However, this was not done that successfully. Any reason why, as to why shared living doesn't really work for Rhode Island consumers?
So I would say that it depends on exactly who the providers are out there. It depends on the individuals. There's certain matches. I think that there were successful efforts in 2016 when we did this. We really looked at our system, and I think that you know, there has been an increase in individuals moving into shared living arrangements, and not necessarily, you know, people who need some type of residential. They don't just go to group homes. There's, you know, there is more of an interest in what a shared living arrangement is. And since I've been here since oh gosh, how long have I been here? Since 14. It's been a while. I have seen, you know, significant growth in people who are living in SLAs. So I do think it does work in Rhode Island, but again, it depends on finding the right match.
Will the idea that caseloads are going down be addressed when the budget folks are part of the meeting?
Yeah, we'll have an opportunity to have a greater discussion. I think there's even some concern that people want to have a more in-depth concern about the change in the budget numbers. And so we'll have an opportunity to do that at that meeting.
Looks like people are saying in the chat that
Yeah.
they can't see the participant list. So I guess maybe.
Yeah, I think if we let people see, you can't see the participant list?
That's what someone is saying.
All
that
right.
They can't see the participant list. So that may be why they just want to see who's on.
I
here.
think because some people can't read, if you just put it on for a minute so you can see all the faces, you know, when you're in public, you can see all the faces of everybody. And if you don't want to be on, turn off your camera.
While people are doing that, I just want to thank Andrew and Michelle and Deb for leading us.
Keith is never here because he's over on Facebook, but he is always working, just so you know. Keith
Okay.
Wilcox is our Facebook guy.
Excellent. Thank you so much for helping us navigate this and getting it done and coordinating the meeting for us. We appreciate it.
And you'll be able to see all this on the the Buddha website. We'll put it on our website too. And so you'll be able to see all these, see everyone. So again, if you don't want to be seen, then you can just turn off your camera. But if you want to see everybody who's here, give it your best shot. Look at all the nice faces. There's Carrie's face.
There's Carrie, yeah.
There's Keith doing over there on Facebook.
Yep.
So there's a lot of humans. Woo!
There's Mary
Some
Sue.
left. There were more.
This is for people of a certain age. This is like romper room, isn't it?
I see Kenny and Brenda and
I get that reference.
of a certain age.
They're still coming.
Still coming. Woo! Oh, I love seeing all the people from our leadership class coming. I'm sorry. My
Yes,
side note.
it's
nice.
good.
Yeah. Everybody wave for taking the pictures. So we'll just so you know, this will be part of the record, and we won't have any really bad shots of anyone except, you know, we'll use those for outtakes.
Yep, always.
Always. All right. So if anybody has any more questions, they can just they can call the DD main number, right?
Yep.
And or email and all of that contact information we'll put that up there also.
Old school raising hands. One of the questions that I saw in the chat was about the office hours. Anne, do you want to talk about the next office hours for the housing initiative?
Yes, thank you, Connie. It's April 17th. April and May will be the third Wednesday. Just at the,
And can you tell them the purpose of those office hours? So that they may be
it's to hear anybody's ideas or questions about what they would like to see for community housing.
Are those recorded? Are those saved somewhere so you could put those? Are you doing them, Connie? The Plan Rhode Island? Are you
Yeah.
guys hosting them?
Then Rhode Island is hosting it.
Yes,
Do you
we are, and we are recording them, and we're actually translating them into Spanish too. I mean, those things have two important purposes. One is people have specific questions, but I believe Anne and Michelle and a lot of other people really need to hear about what the need is out there.
Mhm.
I can just tell you very quickly that about a third of the people who are getting services from the state live in some kind of congregate living arrangement. Okay, and then another third live in either shared living or on their own in some way. The other third are still living at home with elderly parents. That's a large number of people. It's 1,500 or so people who are still have no place to go.
Are some of them by choice, John, or do you know how many are there by choice versus?
Well, no, we don't know how many are by choice, but most of them are. Well, they're by choice because the options are so limited. Okay, so if you don't want to live in a group home, then you're told, well, you better live at home. Okay. If you don't want to live in a shared living, you're basically told, well, you better live at home. So, choice depends on options. We want to promote the fact that there are other alternatives beyond what we currently have. And there's another problem, and the other problem is that there's not enough housing stock in general that's affordable. And so we're trying to partner with the affordable housing movements to make sure that there are more options. Someone talked about SLA. SLA works here in Rhode Island, but it's limited by the way the regulations were put together. And what I've learned is that other states have different regulations that are more flexible than ours. And I think one of the outcomes of our little study is going to be that we're going to get together again and rethink SLA regulations. It's not always just a matter of money, but it's also a matter of who you're living with. It's also a matter of family and siblings possibly providing help, and also the relationship between the person who has somebody living with them. A lot of people are interested in having their own place and then hiring someone to do shared living or bringing them into their house. Right now, that's an arrangement that makes the person coming into the house a renter, a tenant, and they get all kinds of tenant rights. Like, I don't like you living here anymore, but you can't kick me out, for quite a while. And that's kind of an awkward situation. But there are other situations where people live with other people and they provide care. For example, I don't know how many of you in this group are, probably maybe one or two or whatever. If you are rich and you have a live-in nanny, to take care of your children, the rules are different. If you are rich and you have a live-in butler or maid or housekeeper, the rules are different. I think part of the problem is that when the shared living regulations were put together,
the people who were putting together had very limited imagination about what all the possible combinations are. We're starting to learn that there are a lot more combinations, and I'm for one, I'm going to be encouraging that as a state that we reconsider alternative combinations for this kind of stuff. If only an issue for people with disabilities, but it's an issue for elders. Lots of people don't, they have very few options also. They live at home, go to some kind of assisted living, which is expensive, or go into a nursing home, which is institutional living. Some of them might want to have somebody come into their house to be a caretaker, house maker, or whatever. And it's very difficult to do that because all of a sudden the regulations and the rules give that person less, the person who's the host, very few options about changing that arrangement very quickly or easily. And that becomes a huge barrier. Imagine if you hired somebody to come in to help you and you find out you don't like them, okay? And then you say, I want you to move out. And they say, wait, yeah, I will in maybe about 3 or 4 months. And you have to live with a very unpleasant living situation for a while. That shouldn't have to be.
That's what I like about the housing series and bringing in all the speakers we've had, is that we're not limiting our conversations to anything that currently exists.
Right.
Yeah.
Conversations
information.
about what do we want to have happen. And could you get me the links for where the recordings are and as well?
Yeah, they're not up there yet.
When they're ready.
They're being done, but yeah, we will. We'll certainly put it on our own plan website. But
yeah, we'll link to your website instead of.
Yeah, and we'll also make it available. It'll be a Vimeo kind of video site, and anybody can get to them with. We'll pass out what that link is.
We're learning now, but we're not going to change anything overnight.
Right.
Michelle Brophy came from the housing world, and she's making the housing connection, trying to bring in more people, developers to Rhode Island housing. It's both funding and building and other access to make sure that we develop options that help people.
Yeah, we want to promote inclusion. We want to promote, community engagement, and there are some state and federal barriers. Some of them can be changed, some of them not. But we're learning that, as Ann said, what we do in Rhode Island is not the only way to do things, and so we want to help people advocate for more flexibility, more inclusion. I don't see as the solution for everybody as everybody living in subsidized housing with 25% of the people in that complex having disabilities. That's not exactly my vision of inclusion.
So there's another question, John. I cutting you off because there's 4 minutes left, but there's a question that is about that. It wants to know, did the recent referendum specifically set aside funds for affordable housing for those with disabilities?
No, it just set it aside in general for everybody. And it's just a small amount of money to start the process. There's a lot of housing missing. Anytime you have public housing, you have to recognize that it's for a whole collection of different groups of disadvantaged people. People who are poor, people who are old, people who are from underrepresented minorities. So no, and I don't think anybody, at least nobody that I know of, wants just housing for people with disabilities. And that's not anything that I think would be a desirable goal. So we need way more housing, and the referendum will help. It'll start creating some more of that. But even more important than that is we need to develop long-term state funding for these things. I'll just tell you in a nutshell, in Massachusetts, they spend about maybe close to $100 per taxpayer for affordable housing. Connecticut, it's probably about $75 or $80 per person taxpayer. In Rhode Island, it's about 15. We are way, way below the other states around us.
You said 15, honey?
15. And even with this referendum, it's just bumps it up for a couple of dollars. So we need more money. We need a way of funding this stuff beyond these referendums all the time. There should be a steady, constant flow of dollars into housing development. And it shouldn't always just happen in the big core cities. You know, if you live in Little Compton and you want to stay in Little Compton, you should be able to stay there and have affordable housing there. Or if you live in wherever. People shouldn't have to move away from their families, their home communities, where they grew up, just to be able to get into affordable housing. A lot of cities and towns are not building up enough affordable housing to make it possible for people to stay in their hometowns. So there's a lot of work that has to be done. Transportation is a real problem in the real periphery, but most of the state, it shouldn't be used as an excuse.
Thanks, John. Okay, thanks, everybody. Our pleasure to be able to attend, and we'll look forward to regrouping for a discussion on the budget in the next couple of weeks.
Okay.
All right, take care, everybody.
Bye, everybody.
Bye.
Thank you.
Bye, thank you. Thanks for every.
Thank you.